Personality disorders, what they are, symptoms, and how to heal. A personality disorder is not simply having a bad temper or being difficult. It is a psychological condition in which a person has persistent patterns of thinking, feeling, and behaving that are inflexible and maladaptive. These patterns negatively affect their personal, work, and social life. We all have a unique personality, but when certain traits become extreme and cause suffering, it may be a disorder. Symptoms vary depending on the type of disorder, but some general signs include difficulty forming healthy relationships, sudden mood swings, low frustration tolerance, feelings of emptiness or paranoia, impulsivity or self-destructive behavior, distorted thoughts about oneself or others. Some of the most well-known personality disorders are borderline personality disorder, BPD, narcissistic personality disorder, antisocial personality disorder, obsessive-compulsive personality disorder, OCPD. What causes them? There's no single cause. Personality disorders result from a combination of factors. Genetics, there is some hereditary predisposition. Early experiences, abuse, neglect, or childhood trauma are common triggers. Environment and relationships. An emotionally unstable environment can foster the development of these disorders. But here's the important part. Having a personality disorder doesn't define you, and you're not doomed to live this way forever. How it affects mental health. Living with a personality disorder can be very painful. It not only affects how a person sees themselves, but also how they interpret the world. It can lead to depression, anxiety, social isolation, a low self-esteem, suicidal thoughts in severe cases. That's why it's so important to talk about this without stigma, without judgment, and with compassion. The good news is, treatment is available. And yes, things can get better. Here are some approaches that have proven effective. Psychotherapy, especially dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT. Support groups, feeling understood is essential. Medications, in some cases, to manage associated symptoms like anxiety or depression. Healthy habits, sleeping well, eating a balanced diet, exercising, and meditating help more than you think. The journey can be hard, but not impossible. With the right support, many people achieve stability, healthy relationships, and a fulfilling life. If you or someone close to you is living with a personality disorder, don't ignore it. But don't see it as a sealed fate either. Seek professional help. Get informed. You are not alone. Mental health is not a luxury, it's a priority. And understanding these conditions is the first step toward empathy and change. If you like this video, subscribe and share it. And remember, your story doesn't end here. Your mind can heal. Your life can change.